Number 7, which is something a lot of people need to learn, and I think a lot of people need to ask God to deliver them from that spirit of offense, because your feelings have no place in the healthcare field. What's more important and what matters most and what's top priority is the safety and the priority of that patient at the end of the day. Your professor, your colleagues, patients even are going to say something that you don't like. You have to be adult in a situation. You have to give grace most of the time, and you need to keep it moving because it's not worth it. And when you're in class and your professor say something in a tone you don't like, keep it moving, because you trying to embarrass or go back and forth with your professor is not going to work out well for you. I'm just letting you know. Number 8 is very important, and I think you need to start that as soon as you enter the program. When you start getting your course syllabus or reviews, whatever you get from that class, you need to upload it into an AI app, ChatGPT, Gemini, Claude AI, Notebook LM, whatever. You need to upload that information and ask that to create NCLEX-style questions. That's even including the select all that applies. And ask it to give you the rationales on those answers, because it's not always as simple as it seems. And you need to understand why that answer is chosen. You need to understand, why did I have to select all that apply? You have to get used to doing case studies. I'm going to give you an example. So let's say you're caring for an elderly patient and she has extremely elevated WBCs. She is incontinent. When she's going to the bathroom, she says she goes a little bit on herself, and then when she get there, it's just flowing out. So what could this patient be at risk for? So, with that situation, you have to think critically. You have to be a critical thinker. That's why doing these questions help you to become a critical thinker. So, she could be at risk for impaired tissue integrity. She could be at risk for have issues with stress and coping. She could have issues with affection because her WBCs are high. She could be at risk for falling. She could be a fall risk. She's elderly. She's incontinent. She's trying to make it to the bathroom. So you have to think critically in those situations. And doing questions, NCLEX-style questions, will help prepare you, especially for when you take the NCLEX. One that I had to learn, which is number 9. You need to change your mindset. That's even changing the words that you speak out of your mouth. When you are negative about something, you're going to keep facing adversity with whatever you're being negative about. And I'm going to give you an example. So I never really liked math. I always had an issue with math. And I used to say, I hate math. When I started my CNA, GNA, we had to do math and we had to learn anatomy and physiology. I used to say, I hate A&P. When I kept saying that, I was hitting a wall with it. I was not allowing myself to understand and retain the information. And guess what I did? It took me having an issue with the instructor, and for me to examining myself, doing accountability with myself, I say, you know what, I need to change my words. So I started to say, even if I didn't feel it, I had to say, I love math and I love A&P. And you know what that happened? You know what happened? I started to learn and understand math, and I started to really like it. I started to really like my class, I started to really like anatomy and physiology. And guess what? When I got to Standard Healthcare College of Nursing and I had to take A&P as my first course, guess what happened? I got an A in the class because I transformed. I allowed my mind to be transformed and renewed. So work on changing your mindset. Work on not complaining about a situation. Work on changing your thoughts towards something that you seem as a negative situation.